Hello friends, welcome back to my channel. It's Medicine of 101. Today we will talk about torch infections. So it's one of the most important topic regarding the obstetrics and neonatology. Okay. So before starting the topic, let me tell you guys that torch infection is the one kind of the intrauterine infections, or we can say the congenital infections. Okay, that means the infection whatever we'll see over here that will take place where within the intrauterine conditions. Okay. So let's write it over here that basically the torch infections that we'll see were intrauterine uterine infection, or you can say another name for it is the congenital infections. Okay, you can say congenital infections. Okay, is the congenital infections. Now let's write down the term torch. What do you mean by torch? Okay, so let's write it over here, torch. So if I say that, what do you mean by the torch? Now see, torch that will define the different kinds of the positive agents in these infections. Okay. Now first, the T stands for the toxoplasmosis. T stands for toxoplasmosis. So toxoplasmosis. O stands for others. In terms of the others, we will get basically the most important one. In terms of others, we can say the syphilis or the Zika virus. Okay. So it's basically the others. Within the others, we will get syphilis, or you can get the Zika virus. Okay. In terms of the R stands for the Rubella. Rubella virus over here. And C stands for Cytomegalovirus. I am writing CMV, that means Cytomegalovirus. And within the H stands for the herpes. Within the herpes, we will get the two types. One you can get the simplex, or you can get the juice. Okay. Now these are the full form of the torch. So we can say in terms of the all infectious agents, which one of the following, if the question is asked, which one of the following is the most common type? So you have to know in terms of the most common is the Cytomegalovirus. This one. Okay. Now there are some general features in terms of the torch infections. You have to know the general features. Okay. So what are the general features? Let's write down them. So what type of the thing we'll get in terms of the general features? Now see, this basically we'll see in these cases that this is the primary infections to the mother. Okay, this is the primary infections to the mother. So we'll get it over here. The mothers will be infected first. Okay, so basically we'll get it over here is the primary infection. Primary infections, and whenever we're writing the primary infections, so whenever the mothers will be affected, after that will go to the fetus. That means it will go to the fetus over here. Okay. The next thing is over here, most of the infections we're getting over here, that will take place in terms of the first trimester. Okay, we'll get over in the first trimester. So in these cases, we can write down over here, we'll get in first trimester. Now see, the problem is whatever the problem we'll see. Basically, we know that in the first trimester, the most of the organogenesis, we will get the most of the organogenesis that will take place in terms of the first trimesters. Now, if we see in terms of the first trimesters, the torch infections that can take place within the uterine, okay, uterus, then whatever the problem we will see, there will be the congenital, organ abnormalities. So the organs that will be not developed properly. So we will write it over here. In first trimester, we will see what abnormality, because the organogenesis that will be inhibited for these infections. Okay, so this type of the problem we will see in this case. So is the first, let me repeat once again, is the primary infections. The mother will be infected first, then it will transfer from the mother to the fetus. And we know that most of the infections in terms of the torch infections that will go within the intrauterine cavity were in the first trimesters. And in the first trimesters, the most of the organogenesis are seen over here. So whenever there are infections are going in the first trimester, there is chances for the organ anomalies. Organ anomalies. So in these cases, we will see the organogenesis that will not develop properly. Okay. There are some common manifestations. Okay, let me write it over here. So this type of the problem we will see in terms of the general features. We get also some manifestations. Now whatever the common manifestations we get, we can divide this thing in two terms, like antenatals, and we can get in terms of the postnatals. The common manifestations we can get in terms of the antenatal, that means before the birth, or you can get in terms of postnatal, after birth. So whatever the complications or the problems we can get, the manifestations we will get over here. We can get the intrauterine growth restriction that can inhibit the growth. Okay, so we can get it over here, intrauterine growth or restriction. I repeat on intrauterine growth restrictions. We can get also intrauterine death. Intrauterine death we can get also here. We can also get over here, the preterm baby. We can get the preterm baby. The most important over here, we can get the, for these things, you can see also the abortion. Now see, whenever we are talking in terms of the abortions, okay, in this cases, try to understand the abortion that will be for the first time, or that will be for the single time, okay. The abortion that we will see over here for the single time, there will be no recurrent abortions in terms of the common manifestations. So abortions that we'll see over here, that will be first time, or you can say single time, only single time. But there are some exceptions. If we say in terms of the syphilis, so whenever we are talking in terms of the syphilis, now syphilis that can cause the recurrent abortion, okay. Now whenever we are talking in terms of the postnatal, now see, whenever we are seeing the infectious agents are going there, and they are damaging the damage is severe. Whenever we see the severe damage after the birth, so whatever the problem we will see over here, the problem basically we will see in terms of the anemia. We can see over here anemia. So let's write it clearly. So we get the anemia. We can get the thrombocytopenia. We can get the hepatosplenomegaly. Megaly. We can also get in terms of jaundice, neonatal jaundice. Now see, this type of the thing, when you will see these agents, after the birth, that will cause the most, whenever they will cause the severe damage in these cases. So in a nutshell, we can say whenever we will see the neonatal sepsis, whenever we will get the neonatal sepsis, then we can see this type of the findings. So in a nutshell, we can get it over, write it over here, neonatal sepsis. Neonatal sepsis over here, okay. Now we'll talk about individually each of the disease. For example, we'll talk in details or in each of these. For example, the toxoplasmosis, syphilis, or Rubella virus, Cytomegaly virus. Okay. Now I'll start with the Rubella. Okay. So Rubella congenital syndrome. Let's talk this one first. So let me erase this part over here. Where is this one? Where is me? Sorry guys, my eraser is over here. So let's talk about right now each individual disease or the infections. Okay. First we'll talk about congenital rubella syndrome. Okay. Now first we'll talk about congenital or rubella syndrome. Okay. Now see, the congenital rubella syndrome is the most severe one. See, is the most severe one. And if you talk in terms of the clinical manifestations, whatever the clinical manifestations we'll get over here, we can get in terms of a triad. So we'll get a triad over here. And whatever the thing we'll get over here in these cases, okay. Now see, whenever we are talking in terms of the triad over here, So what type of problem we will see in this infections? Okay, that means in terms of the congenital rubella syndrome. So let's write over here. We'll get the cardiac defect. We'll get the cardiac defect. Okay, within the cardiac defect, we'll get the most common type. What that one? The pattern. Okay, ductus arteriosus. We'll get the pattern ductus arteriosus over here, and we can get also, we'll get ventricular septal defect. We can get the ventricular septal defect at the time we see in the fusions of the ventricles. Okay, and we'll get also over here the pulmonary artery. Pulmonary artery. Okay, let me use this together. So it's not working over here. So we'll get it over here on the type. The problem that is at the cardiac defect level, we'll get pulmonary artery stenosis. Pulmonary artery stenosis. In these cases, we will see the right sides. For example, the right side is having the more chances with respect to the left one. So this type of the problem we will see as far as the cardiac defect is concerned. The next, whatever the problem we can get over here, we will get the deafness. And in these cases, we will get sensory neural. We will get sensory neural hearing loss. We will get sensory neural hearing loss. And in these cases also we can get another type of the thing in terms of the tide. We will get the cataract. We will get the cataract. There will be problem in the lens. Okay, the protein that is making the lens, that will get breakdown in these cases. So there are chances for the loss of the vision in these cases. Okay. The other types of the things, what type of the manifestations we will get in terms of the congenital rubella syndrome. I have already mentioned over here the three triad. Over here we will get the cardiac defect, we will get the deafness, we will get the cataract. Now this is the eye problem. It's also the problem at the eye level. Now if I say what type of the problem we see the most ocular manifestations, if I say the most common ocular manifestations, that will be known as what? Salt and pepper retinopathy. Salt and pepper or retinopathy. This will be the most common ocular manifestation in terms of the congenital rubella syndrome. Okay. Then we can get in terms of these things, like in terms of the brain. Okay, whatever the problem is in terms of the brain, we can get also the infections, that is stands for in terms of the PRP. PRP stands for, let me write it over here. We'll get progressive. Okay, rubella. We'll get progressive rubella panencephalitis. We'll get the inflammations within the brain. Okay, in these cases. And the other chances things, or we can say in terms of that other symptoms, or say risk factor we can get in these cases, the diabetes. Chances for having the diabetes is more. We can get also in terms of the hypothyroidism. Okay, in these cases. Now how can I do the investigations? Now if you talk about in terms of, these are the clinical manifestations in terms of the congenital rubella syndrome. Now how can we do the investigations? In terms of the investigations we can do over here, we can just take the IgM antibody, we can write it over here, anti-rubella antibody, in terms of IgM antibody over here. Now we can just mix with the sample, and if we get the negative findings, for example, but if you are suspecting the individual is having the chances for congenital rubella syndrome, and the first time if we get the negative, after a few days again we can do the test for the final confirmations. Okay. Now what about the treatment? See, in terms of the treatment, there is no drugs available to treat this kind of the disease. Here you can use the vaccinations. What kind of the vaccine we can use over here? That is RA 27 by third strain. is the vaccine available we can do. So this was all about in terms of the congenital rubella syndrome. Okay, this is the most severe one, and what are the clinical manifestations I have already said. In terms of the triad, we will get the cardiac defect, we will get the deafness, we will get also the cataract, and the most common ocular manifestations we will get in terms of the salt and pepper retinopathy. Okay, and in terms of the brain we will get progressive rubella panencephalitis. There is also chances for increasing the risk of diabetes and also hypothyroidism. And we can do the treatment in terms of the vaccines, and we can just do the diagnosis in terms of the IgM antibody over here. Now we'll talk about the next part in terms of the cytomegalovirus. Okay, let's write down about the cytomegalovirus over here. Now, the second type we'll talk about congenital cytomegalovirus. Okay, now see. In these cases, we will need to know that the transmissions we will see around in the third trimester. So, basically, I have already mentioned that most of the infections will get the transmissions in the torch infections in the first trimesters, that I already discussed in terms of the general features. But there are some of the exceptions, just like this one in terms of the congenital cytomegalovirus that can be transmitted in the third trimesters. Okay. Now it can be transmitted. Now these transmissions can be seen in terms of the intrauterine and postnatal also. So let's write it over here. We can get in terms of intrauterine and postnatal. Okay. Now first we'll talk about intrauterine. Okay, now see, in these cases we'll see most around 90% of the individuals, okay, they are asymptomatic. 90% of the individuals, they are asymptomatic, okay, but 5% we can say we can just get the symptoms over here. So around 90% will get asymptomatic. Less than 5% will get their symptoms will be appear in terms of the less than 5%. And we can get it over here, congenital cytomegalic inclusions disease. And here we will also get the triad, just like the in terms of I already explained in terms of the congenital rubella syndrome. We will get also the triad over, and whatever the manifestations will get, clinical manifestations will get over here. Okay. Here we will get first the chorioretinitis. That means we'll get then inflammations of the choroid, and the retina. Choroid and retina will get the inflammation of the choroid and retina over here. The second type of problem we'll get over here, we'll get the microcephaly. That means the size of the brain that will be reduced. We'll get this one. And the most important one, let me write it over here, we'll get the intracranial calcification. Intracranial calcification. Okay, now see, these calcifications we will see around the ventricles. That means the periventricular calcifications. We will see the deposition of the calcium around the ventricles of the brain. Okay, so we can write it over here, that in terms of what? Periventricular. Okay, periventricular. Now here you can also see the deafness, just like the congenital rubella. Here you can also write it over here just like this. In terms of the most common, you can see over here also the symptom, that sensory neuronal hearing loss. This type of the problem we can see also over here. What about the diagnosis? How can we do the diagnosis over here? In terms of the diagnosis, we say, let's write it over here. In terms of the diagnosis, how can we do the diagnosis? Now diagnosis we can do by some testings. Now the test of choice in these cases, If I say whatever the test we can do in terms of the test of choice, we can do the PCR testing. We can do the PCR testings. We can also do the IgM antibodies by taking the antibody IgM, but the PCR is the best one. That's why I have written test of choice over here. Okay. Now we have to do the test within the 2 weeks after the birth. Within 2 weeks after birth. After birth over here. Okay. And if we get the positive, then whatever the treatment we have to do over here, in terms of the treatment, okay, let me use this one. In terms of the treatment, okay, let me write it over once again. In terms of the congenital cytomegalovirus, whenever we are talking in terms of the treatment, how can we do the treatment? We can use ganciclovir. We can use over here ganciclovir. We can use these drugs. And at first we have to use these drugs through intravenous route for the 6 months. Then after that we can use through the oral route the next 6 months. Okay. Now in terms of the treatment, when you are using the drug ganciclovir, okay, at first we have to use it through the intravenous route for the 6 months. And the next 6 months we have to use the orally. Okay, we can give the drug orally for the next 6 months. This is the treatment. Now in terms of the, this is all about the intrauterine. Okay, now if you talk about in terms of postnatal, in terms of the postnatal, how can the transmissions we can see through the breastfeeding. You can see through breastfeeding. Through breastfeeding, we can see the transmission of this syndrome. Now the next part we'll talk about the toxoplasmosis. Okay, so this was all about in terms of the congenital cytomegalovirus. Now we'll talk about in terms of toxoplasmosis. So let's erase this part over here. Toxoplasmosis. Okay, one thing you can mention over here, that whenever you are doing the PCR test over here, when you are doing the PCR test, we can just take the different kind of the sample. We can take from the saliva, we can take the sample from blood, we can take the sample from urine. The most important, or we can just take, if we take, there is the urine is preferred, after that blood. So blood will be followed by the urine. That means the first, if we say as far as the sample is taken, so we can say the urine will be the best. Then we can take the blood over here. Okay, now let's talk about over here the next kind of the disease, congenital toxoplasmosis. So congenital toxoplasmosis. In the same way, the transmissions we'll see in the third trimester. Transmission will get in third trimester. And whatever the clinical manifestations we'll get here, we will also get a triad. Okay, let me use this one. First, we'll get the chorioretinitis, just like this one. I mean, in terms of the cytomegaly, or retinitis. We can get also, in this case, we'll get the intracranial calcification. Now, don't get confused in between this one. Here I have written cranial calcifications. Here I have also written intracranial calcifications. But see, in terms of the cytomegaly virus infections, we'll get the intracranial calcifications around the ventricle in terms of the periventricle. Okay, but what about this one? We'll get the intracranial calcification in terms of the congenital toxoplasmosis. Here you will get the diffuse. That means it will be scattered within the whole brain. Okay, so it will be the diffuse, not in particular place. Okay. So you can write it over here, it will be diffuse. Okay, this one. So we got chorioretinitis, we got the intracranial calcification, and in these cases we will get hydrocephalus. Here I have written what? Microcephaly, the brain size will get decreased, but in these cases we will get the hydrocephalus. So these questions can be asked. It's important point you can remember over here. that in terms of the congenital toxoplasmosis you will get what? The hydrocephalus over here. Okay. Now we have to talk in terms of the what investigations. So let's write in terms of the investigations or diagnosis. So not working. In terms of the diagnosis, what can you do? You can just do IgM ELISA test over here, or you can do the IgA ELISA. Now the IgA ELISA is the most sensitive and the preferred one with the comparisons with respect to the IgM ELISA. So IgA ELISA, that will be what? IgA ELISA, that will be preferred and sensitive. Preferred because it's sensitive. Okay. Now another thing we can do, we can also do, okay, no need to remember that thing. So just remember these two, IgM, and if you want to remember you can write IgM is agar. IgM is agar stands for IgM immunosorbent anticoagulant assay. We'll get IgM immunosorbent anticoagulant assay. We can do this test also. So the three diagnoses we can do just to confirm whether the individual is having congenital toxoplasmosis or not. Now, if under the treatment, whatever the thing you can do over here, whenever we are getting the confirmations, yes, the individual is suffering from congenital toxoplasmosis, then whatever the treatment you can do, we can use the treatment in terms of the treatments. We can use pyrimethamine. We can use pyrimethamine plus sulfasalazine. Along with that, we have to use some supplementations over here. Okay, whatever the supplementation we can give over here, we can use the folinic acid. And we have to continue for 1 year this one. Okay. Now I'll talk about, for example, whenever we are doing the treatment, or whenever we are just, for example, for any reasons we came to know that the pregnant woman who is having the toxoplasmosis infections. Now just to reduce the chances for transferring, or just to reduce the transmissions of the toxoplasmosis from the mother to the fetus, we can use some drugs. Okay, let me write it over here. Now we can use a drug that is known as spiramycin. Now the spiramycin that will reduce the transmission of toxoplasmosis from mother to fetus. So in terms of the treatment, we can use this type of the thing over here. Okay. So that's all for today. So I have already described over in terms of the three. I have at first I described in terms of the congenital Rubella syndrome. Then I did talk about congenital Cytomegalovirus. After that, the last I did talk about congenital toxoplasmosis in terms of the clinical manifestation, diagnosis, and treatment. Okay. The subsequent part we will talk about in terms of the herpes simplex, herpes zoster, and the rest of the things. So if you think this video is helpful for you, please do like and subscribe my channels, and please support me. I need your support, guys, and please let me know whatever the videos do you want to clear your concepts, okay, and to have the more information regarding your exam is concerned, okay. And please comment in the below, okay. Then I can understand what do you want from me. So thanks for watching. See you in the next video soon.